Hey, Ideal Protein Nation around the world. Boy, I have got an incredible show for you today. I am super, super excited about this. I know I say this every week, but man, the guests, they just keep getting better and better. The story is amazing. So we are going to get to it. For those of you who are tuning in for the first time, and I know that we're going to get some, definitely going to get some new viewers and listeners on this one, because this one's going to be circulated really well. Big story. I created the Life Possible podcast to spotlight successful clients, coaches, and clinic owners who have used the Ideal Protein protocol to reset their body, reset their mind, and actually reset what's possible for their life. These individuals truly have had life-changing experiences, and as a result are pursuing goals and dreams they thought were dead and gone. They're pursuing goals and dreams they never thought they could. And some are pursuing goals and dreams they never even dreamed of it before. So in short, they're living what we like to refer to as life possible. So who am I and why am I even doing this? Well, I tell you what, my name is Dr. John Barnes. And you know what? There is no easy way to put this. But about 6 years ago, I was fat, sick, and depressed. And the thing about it was I had gotten myself to a point where I didn't see a way out of it. Nothing that I knew how to do before it worked for me anymore. I knew that my metabolism had absolutely changed and shifted. And so I gave up on trying to lose weight and trying to be healthy again. Until one day, I truly believe that God answered a lot of my prayers, both personally and professionally, with the Ideal Protein protocol. So now, these days, I'm living a life that is healthy, vibrant, and alive. Initially, I lost 45 pounds when I did the protocol the first time, but not just with the weight loss. It totally changed the way that I felt on the inside and my ability to actually be active again. So for the past two and a half years, I have been training and racing in the sport of triathlon after over 25 years of inactivity. And truly, I've gone down the rabbit hole to discover the science behind the power of this protocol and its ability to change all sorts of health conditions by virtue of its very nature. So, who do we have for you today? Well, I tell you what, my guest today is none other than Jill Bailey. Who's Jill Bailey, might you say? Well, I tell you what, Jill came to me on Facebook. 2 weeks ago, when I posted episode 29 with our very own Mary Kay Locks, she commented on our post, and she said, I lost 100 pounds in 10 months and was able to get pregnant without medical intervention when told it wouldn't be possible. Ideal Protein changed my life. And so I said, of course, sounds like you'd be a perfect guest for the show. What do you think? And she said, yes, I would love to. And so I have spent the past 2 weeks getting to know this young lady. She is an absolute joy. Her story is fantastic. And I'm really, really hoping that her story is going to touch and change so many lives for so many young women around the country and around the world who are dealing with the syndrome, polycystic ovarian syndrome. So let's go ahead. She's coming to us live today from Indianapolis. Let's bring on Jill Bailey. Jill, where are you? I'm trying to bring you. There you are.
Hi.
Hey, how are you?
I'm good. How are you?
I am doing great.
Great.
Man, I tell you, I've been just for the past few days so excited putting together the outline and the graphics for this show. Like I said, you and I have had some fun sessions preparing
Yes.
and telling your stories. So I'm super excited to get this story out.
Great. Me too. It's been, like I said earlier, just thank you for giving me a chance to kind of share my story on your platform. I think it's a great place to be.
Oh, thank you. Thank you. No, your story, like I said, thank you for wanting to share your story. And I hope that this will also stimulate so many other people that have had transformative experiences through Ideal Protein to come forward and want to be on the show.
Right. I hope so too.
All right, well, let's get going because we got a lot of ground to cover.
Yes.
As always, I do like to try to with our clients and our guests start kind of at the beginning in childhood and get us to the point where you may or may not have struggled or started a struggle with weight.
Yeah. So, normal childhood, grew up in a small town. So, only child, ran around a lot, was really active, involved in, school sports, community sports, things like that. Volleyball was the big one for me. Started when I was about in the third grade, played through middle school, played through high school. I played for like a USA Volleyball National League where we traveled
Wow.
around like cluster states and things like that. And then a little bit more recreational in college, but it was still pretty competitive.
Okay.
And then, kind of phased out of that. And then it was, I would say it was about high school when I was about 16, 17, where I really started to notice my body shifting more as I was going through puberty, and just, natural age and maturity. Just really started to notice things were slowing down. It wasn't, I was still active, but it was just, I could feel something different, and I wasn't quite sure necessarily what that difference was, but I
Mhm.
knew, it was showing in the form of weight.
And again, it's you were such an active athlete, right? And that's
Yes.
and that's why it seems surprising to people when they are so active, and yet they do start having those changes.
Yeah.
Yeah. Okay. So, but again, even a little bit of USA volleyball, that's cool. High
Yeah.
level,
It
man.
was, I have to thank my parents for really, because I mean, obviously it was parent taxi on the weekends,
Sure.
but I enjoyed it so much. It was just always, I liked having that competitive drive. I mean, it was 7 days a week. It was practice through the week and tournaments
Hmm.
on the weekends,
Hmm.
and it was just kind of my own little community that I had, honestly.
Sure.
Just it was great. If I could redo my childhood again, 100% would choose that
Same
over
thing.
again.
That's
Yeah,
awesome.
definitely.
Awesome. Okay. So yeah, but again, as you and I were talking, going through puberty and things are changing for you. Take
Right.
us take us through kind of what was going on there.
Um, well, to be honest, feelings was, frustrated. I was still really active, and just I it was in my midsection, honestly, where I was like, what is going on? I'm not understanding necessarily what's happening to me. And I mean, you have health class in high school and things like that, but they don't really go into like how your body processes foods and metabolic energy and how the pancreas and everything is kind of tied in together.
Right.
I just didn't know. I actually would joke and be like, "Oh, is this what aging is?" Like,
Okay.
like,
We're in high school.
yeah, like this kind of sucks. Like, is this kind of preparing me for the future? And and it continued on through college, and I just felt an overwhelming sense of frustration.
Okay.
No matter what I did, it just the pounds just kept coming on. It wasn't fast, it was slow,
Mhm.
but it was steady. Definitely
Okay.
from 16 well into my 20s. Definitely very consistent, slow, but definitely gained.
Okay. Okay. How about two then? When did you start to notice issues with your cycle and things like that?
I would say probably again about 16, 17. Things just started to get really irregular, very painful, to the point where I was missing school. I was going to the emergency room.
Mm.
Just so many questions. And it was the typical, take Midol, take this, rest, heating pad. And it was just like something inside of me was like, this can't be the answer for this. This is like, and I felt like I was alone. My girlfriends weren't experiencing this.
Okay.
My mom wasn't experiencing this. this felt unnormal and
Yep.
unnatural to me. And I
Yep.
just felt like there was more than just, oh, sorry, you kind of need to just tough it out.
Okay. Yeah, and I can see where that would be very frustrating if people weren't really understanding the more serious nature of what you were feeling or going through, and that just kind of continued on into your 20s.
Yeah, pretty solidly. Especially when I got, when I started life on my own as an adult and, lived on my own and was taking care of myself, it would happen. And I just basically would chalk it up to, oh, okay, here it is again. Let's try to go to work and make the best of it.
Wow. Yeah.
Let's try to go to class today. It, I just felt like this was something that I was almost sentenced with. Like, you've got to learn how to manage your life with this whenever it happens, type of deal. But it just, like I said, something internally just kept saying, Jill, this is not how we're supposed to be living. There's no way.
Yeah. Okay. 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 So you're on your own. You're in your 20s. You meet a boy.
Yes.
Yeah. Right. We meet a boy,
Yeah,
and Jill gets married.
I
Yeah.
do. I do
Yeah.
literally.
Yeah. Right. She says, I do. And she gets married. So exciting. So beautiful. Such a beautiful dress.
Thank
I
you.
love it. All your pictures were wonderful. I had a hard time choosing from everything that you had up on
It
Facebook.
was um the day we got married. It was in May. It was the middle of May. It was 40 degrees that morning.
Holy cow. Definitely a
Yeah,
lot different from what it is now.
everyone was in jackets. I felt horrible. I was sweaty. I still to this day, I thank everyone whenever my anniversary comes up. I'm like, if you came, thank you. It was a
Hey,
cold one.
hey, 40 degrees is nothing. One of my best friends got married in Boston in February, and I still haven't forgiven him.
No.
Oh, dear Lord, that's cold. This is nothing. Excellent. All right. So you guys got married, and when did you start thinking about, possibly kids, possibly a family? Did you talk about this before you got married?
Yeah, it came up. My husband has always known that, being a mother was something that, I've always dreamed about becoming. And, having a family was important to me. We wanted to get married and enjoy our life
Mm-hmm.
together, start
Mm-hmm.
our family, just the two of us, form it. And we were married for about 2.5, 3 years, and kind of got our first place and decided, let's get more serious about this. We're in a great place. We're both settled in our careers and in our lives, and it's time to take that next step. And so we just kind of decided to explore that avenue.
Okay. Okay. And along with that, then, did you already start to have issues with it before you sought medical attention, or were you in the process of understanding that it was going to be hard for you? Or walk us through where you are as far as that goes, because
Yeah.
you still don't have a diagnosis.
No, I
You
did
still have
not.
no idea what's going on.
Right. I did not have a formal PCOS diagnosis at that time. All I had pretty much been consistently told was, Jill, you've got to lose weight before we pursue this avenue. That was really the only thing that was being told to me. There were thyroid tests and things like that were coming back normal. But it was just mostly the consistency of you're overweight. If you and your husband want to try having a family, eventually, that I hate that word now,
Mm-hmm. Mm-hmm.
it, the weight needs to come off. And that was basically where it was always left at. And, as an overweight person, you understand, I'm very well aware that I need to lose weight to be a healthier person. And so we started, just kind of weighing our options, me seeing a doctor, trying to find, a primary care physician that was going to try to kind of get me in the door of where I needed to go. And just start opening doors, seeing, kind of where we needed to be individually and together. But, mainly the main thing that kept coming back was, your BMI is too high, your weight's too high, we can't help you until you kind of help yourself. But then that was just kind of where it was left at.
Mm-hmm. Yeah. And again, just so frustrating when you visit your doctor and then they tell you that you need to lose weight and a significant amount of weight,
Right.
but yet they don't have an option for you, right? They don't have a place to refer you to, right?
Right.
And so they're just like, good luck, come back when you're successful.
Yeah.
Right?
It was basically literally like, okay, lose the weight and then make an appointment. And then we'll come back and discuss what's next. And it's like,
Yeah.
okay,
Okay.
thanks. Bigger question mark.
So then get us to the point where you were diagnosed with PCOS or polycystic ovarian syndrome.
That was eye-opening for me. I had suspicions. I had scanned Google here and there. It was kind of like a light bulb for me when the doctor came in and she had kind of said polycystic. I was like, okay, what is it? What's next? What do I do?
Yeah. And I think you bring up a great question. What is it? Right? Because from time to time I talk or I give talks, and when I bring up the subject of PCOS, like I said, some people, they look at me like a deer in headlights because they've never heard of it before. But some
Right.
people are just sitting there shaking their heads because either they have it or they know somebody who's got it and who
Right.
is struggling because they're not really been given a whole lot of direction or a whole lot of answers.
Right.
So let's go through that real quick. I just thought this would be great for our audience because so I did what Jill would do. I got on Dr. Google and I Googled polycystic ovarian syndrome so that we could get a neutral source that would just kind of give us the basic information about this condition. And what I found was really pretty fascinating. Number one, it talks about the fact that it is a syndrome. It's a hormonal disorder primarily among women of reproductive age. And it's the hallmark is basically infrequent or very prolonged cycles, right?
Right.
So when we talk about the symptoms, the signs and the symptoms of PCOS, irregular periods, excessive androgen production, in other words, excessive male hormone production in a female body, right?
Right.
And then polycystic ovaries that develop so many of these small cysts inside them that it makes the ovaries get enlarged. So those are the three hallmarks, and I think there's something like you have to have at least 2 out of 3 or something like that to actually. I'm not sure.
I had 3 for 3, so
you were 3 for 3.
I was 3 for
Excellent.
3.
So then if we go through Dr. Google again, like I said, I got this off the Mayo Clinic website. So it's a neutral observer, just kind of a third party that's just telling us about this problem. The causes section. So the causes section says the exact cause of PCOS isn't known. Factors that might play a role include, and the number one answer here is excessive insulin. Insulin is the hormone produced in the pancreas that allows cells to use sugar, your body's primary energy supply. If your cells become resistant to the action of insulin, then your blood sugar levels can rise and your body might produce even more insulin to try to deal with that. Excess insulin might increase androgen production. And so there's going to be our tie-in between excessive insulin production in someone's body and excessive androgen production inside a woman's body, that it should not be there. And that makes it difficult to ovulate. All right. So there's a huge tie-in that is the number one on their list of potential causes. It also talks about low-grade inflammation. And again, it's kind of fascinating that this low-grade inflammation we often find is tied to excessive insulin production. So they kind of go hand in hand. They, of course, have to talk about heredity. Research suggests that certain genes might be linked to PCOS. And then for some reason, they just go back to the idea of excessive androgens. Now, also, they have a complications section, and I found this particularly interesting, especially in all the research that I've been doing in insulin resistance and metabolic syndrome. Complications of PCOS can include infertility, and that's why we just talked about gestational diabetes or pregnancy-induced high blood pressure if and when someone gets pregnant, but also non-alcoholic fatty liver, right? So non-alcoholic fatty liver, metabolic syndrome, which includes high blood pressure, high blood sugar, abnormal cholesterols and triglycerides, and it significantly increases your risk of cardiovascular disease. Well, all these things are understood by doctors that all go hand in hand with insulin resistance. This excessive insulin production and your body's not listening to it, so to speak. Type 2 diabetes and prediabetes, sleep apnea, depression, anxiety, eating disorders, abnormal uterine bleeding, and it can even potentially contribute to cancer of the uterine lining. So all of these things are potential complications, but for someone who's actually been researching and understanding all the science behind this, what really shines through to me is the direct link to insulin.
Yeah.
And is that anything that you kind of found? Did you see any of that stuff when you were on Dr. Google and you were out there
Yeah.
looking at stuff?
Yeah, pretty much all of those things. You try to be weary when you read those things, but I mean, when I was just kind of, after my initial diagnosis, I kind of, like I had mentioned earlier, fell down the rabbit hole. I suffer from a lot of those things, and when you get an answer and you're just kind of making links together, you have an aha moment, like,
Yep.
oh my gosh, okay, here we go. We've found that missing link to the great question of, like, what is wrong with me?
Yeah. Right.
Yeah.
Right. Well, and again, you can only read so many times the things that you're like, oh, I have that. Oh, I have that. Oh, I have that. Right. And you can just see
Yes.
those patterns developing. So again, you get this diagnosis, and then, do I understand correctly? Then you had to go to an endocrinologist next, right?
Yes. So I received the PCOS diagnosis, and my primary care physician recommended seeing an endocrinologist. She thought that I needed to get my more level work done, just kind of dive in a little bit more to, where is the real complication lying? Is it insulin resistance? Is it, lifestyle? Is it, something else? We just needed more answers from that diagnosis. So I went to go see an endocrinologist, and had the whole nine of blood work done. Kind of knew what was going to come back because I'd had similar blood work like this done before. And it came back, and my A1C was high, pre-diabetic, which nothing new for me. That was something that I've always consistently had when I had blood work done.
Okay.
But the main thing, that she stressed was, you need to lose, she said, a minimum of 100 pounds.
Wow.
It was, it's one
Wow.
thing to think that internally, but to be told that by someone who you've just met and you're kind of bearing your soul to, at least I was, I so desperately wanted to go to this next chapter to figure out what was next for my family. And being told that, it feels very daunting. It's like, excuse me? Like,
Right. 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 I
it's,
mean, seriously, can you wrap your head around losing 100 pounds? I mean, again, like I said in my intro, I had gotten to the point where nothing was working for me. So I gave up even trying to lose 20, and
right.
so
Yeah.
many people are in that space. They're frustrated. Nothing seems to be working. And if they are successful at 10 or 20 pounds, oh my gosh, if they stop and take a breath, it comes right back.
Yep.
So to sit there and tell somebody, boy, you've got to lose at least 100 pounds. And then what was the caveat to that?
Basically, the caveat was, and I'm still a little bitter about it. It basically was lose 100 pounds, come back in 2 years, and then let's have a conversation.
Wow.
Which was just like, I understand she wanted to be realistic with that because, like you said, 100 pounds is a lot. But I said, I remember my response being 2 years. Like, I mean, do I have 2 years? Yes, but I don't think it would take that long. I feel like I felt like there were so many other answers and avenues that could be explored in less than 2 years, in a
Mhm.
year, that could help me get to where I needed to go. And I was just at that point, I knew. I was like, okay, there's got to be something else. And that's when my brain just kind of went, okay, we've got to go in ultimate search mode.
Okay. So you left there angry, frustrated, sad, and went into search mode. And that led you where?
That led me to Indiana OBGYN with Dr.
What?
Nowacki with Axia Women's Health. They have
Yeah.
they have been just incredible. And I know I say this literally every time I go in, but just, oh my gosh, just truly, truly, just such a passionate group of care providers.
Oh, that's so neat.
Yes, it was a
Yeah.
nice change of pace.
Yeah. So you go to this place and you meet Dr. Nowacki, right?
Yes.
Now she looks at you and says pretty much the same thing. Hey,
Mhm.
you got to lose weight. But what was the kicker with her? What made her different?
With Dr. Nowacki, her message was more gentle. You know, she knew what I was going through was very fragile. I expressed very, very loudly my frustrations to her, you know, why I had made the switch. You know, I was so desperate for just something different, something more. And, you know, she focused more on not so much the number, more of overall health, overall, you know, getting the BMI down to a more acceptable weight, you know, learning that your body responds better when, you know, when you do lose weight, and you tend to have more success with a, you know, kind of one thing leads to another, when you
Yep.
really start to notice the weight come off. And, you know, she, you know, we had discussed, you know, pretty intently, you know, PCOS, and, you know, she kind of dove into me a little bit more intimately with the things that I was experiencing and why. And she just kind of answered some of the more deeper questions that I had into, you know, having polycystic ovarian syndrome and being overweight, and how those things kind of fell one into the other. And it just made me feel like I understood it more and wasn't offended just having a doctor come in and say, hey,
Yep.
you
Yep.
got to lose weight. It was, you know, let's take care of this, you know, as gently as we can, and let's, you know, let's work on your health.
And she actually had a weight loss option for you.
She did. She had ideal protein for me. It was, you know, it was, she kind of gently guided into it. There was like a little picture in the room that I was in, with, you know, kind of the trifold with the 3 steps or
Yep.
protocols. And,
Yep.
you know, she handed it to me, and, you know, she said, we've had some people who have had great success with this diet, not diet, you know, protocol. And, you know, I think you would be a great candidate. And the thing that stuck out to me was, if you, if you stick to it, if you eat the sheet, you're going to lose. You know, if
Right.
you follow the protocol, you will be successful. And that was just, that immediately resonated with me, because I was looking for something so similar to that, where I could just, it was very laid out, and it was, you know, no nonsense. And it was just, it made sense from the very beginning when she was explaining everything initially.
Yeah, but again, what a refreshing situation to be sitting in a room with a doctor telling you once again that you need to lose weight, but also offering you a viable option that they actually have in their clinic that they have seen work and that is successful. I mean, that's got to be super meaningful for you, right? As a
Oh,
new
yeah.
patient.
Oh, yeah. And I mean, that was literally my first visit with Dr. Nowacki. She
Yep.
immediately, you know, had provided me with a possible solution. And that solution to me immediately made sense. The science was right there in front of my face, which was what made it so different than any other thing that I've ever, tried or explored. It was my aha moment. She
Yeah.
really kind of just helped me get that light bulb on and realize that it's not about a diet, it's about the science behind how our body works.
Yeah. 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 Oh, that's so fantastic. And so, how long did you mull over the decision and how long did it take to get started?
Not long, a week.
Yeah. Right. There you go.
I I went home and, gave my husband the pamphlet, slapped it on the table, and I was like, "We're doing this. We this is I want to try it." I so believed in the message that Dr. Nowacki had given me with ideal protein. And I was ready at that point. I was ready for anything. I was just ready for that next step.
Yeah, yeah. Well, again, that's the thing. After all those other doctors and after the frustration that you've had, this is like an oasis. It's a breath of fresh air, and it's with the new doctor who is also going to be your new OBGYN. It's a
Right.
natural fit. The interesting thing, my regional vice president, when she first opened my clinic with me, she said, John, the two most common places that you're going to find the Ideal Protein program are chiropractic offices and cardiology practices. And being a chiropractor, I understood that because we've always been about whole health and nutrition and wellness, and cardiology practices because they're kind of tops on the list of things that can be helped, changed, or reversed by putting the program in the office. But
Right.
truly to me, number three, or right up there as number one or number two, I fully believe it should be part of an OBGYN practice. And if that's not a logistical possibility, that they should hook up with and find the nearest Ideal Protein clinic that they can refer their clients to, because
Right.
we are brought up to have great provider discussion and communication with providers.
Right.
We are taught to, this is a medically developed protocol and it is professionally supervised.
Right.
So it's something that a doctor can have full confidence referring their patients to, knowing they're going to get feedback from both the clinic and their patient about
Exactly.
their success, right?
Exactly. I'm a huge advocate for that now. That was something I had never seen before. And, when you're a woman dealing with that, you feel overwhelmed, and kind of having that answer, that option, for me was just, it was new and I was ready, and it just felt right. Something
Yeah,
inside me just said, Jill, go do it. The worst thing
yeah.
that happens is you got to find something else.
Right. Right. Yeah. No. And again, Ideal Protein came out with the slogans last year that weight loss is healthcare. Right.
Yeah.
And truly, Dr. Tran would tag on to that line: weight loss is healthcare that you deserve.
Yes.
And this is the perfect example of that happening in your life. So, how
Yeah.
exciting is this? Great. So, you start the journey, you go in and you meet your coach, Coach Stephanie.
Yes. Stephanie, I when I first met Stephanie, we just connected. Kindred spirits, I feel like. She could sense my level of frustration. And I mean, I shared with her, how passionate I was to, get this weight off and really just see what could happen. Cause I didn't know, what was lying ahead of me in this journey. Cause truly it's a journey.
Yep.
And I just, from day one, Stephanie was just so helpful, and just, I had 10 zillion questions for her about
I, I can't imagine that.
me never, come on now. And I mean, every question, every stone,
Yeah.
she was just so well versed in getting me the initial answers that I needed to make me just decide, let's do it. Let's go.
Yeah. 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 And, again, a lot of times, most often, that first week cinches the deal. right?
Yeah.
After that first week or two, there have been so many changes to your body, to your metabolism, to everything. Usually there's enough final motivation there to say, okay, we're off to the races. Let's go.
Yes, seriously. I think it was like day 7 for me. And I had mentioned this to you last week, where I woke up and I felt like I didn't need to drown myself in coffee. I was just like, who am I? Like,
Yeah, right. I'm awake.
here I am,
I've got all
hello.
the energy in the world. Let's
Yeah,
go.
it was, it just for the first time in my life, I felt like a new person.
Yeah. Yeah. And so things started to move. Let's bring in some of these graphics. And
Yes.
two, it was interesting when we were talking that you said that you decided that you were going to be very public about this too, that you were going to document your journey on social media.
Yeah.
Tell me about that decision and why.
So, with being an overweight person, sometimes you are subject to ridicule and being teased and things like that. And those things was very open about my feelings and how I felt being an overweight woman and the things that I was subjected to. I decided this needs to be both sides. I've been open about the struggles that I've had. I need to be open about, the potential struggles that I'm going to have on this journey, but not only that, the success that I'm going to have on this journey. And, maybe I can inspire someone else. They can be like, wow, she's really putting herself out there. Maybe.
Well, that's just
Yeah.
it. You're putting yourself out there and, gosh, public failure if this doesn't go well, right?
Yeah. And that was something I worried about. But, when I got through that, first 2 weeks and
Yeah.
even my first weigh-in, when I had lost like 12 pounds, I was like, what's failure? Failure was not an option for me at that point.
Right.
I was seeing numbers of loss that I had never seen before in my life. And that to me was just like you said, off to the races. Let's see how far we can take this number.
Yeah. And again, too, one of the biggest things that I'm getting a little feedback. I don't know if, okay. One of the biggest things we talk about is how well you feel, right? That it's just, it's the most amazing thing to feel so good so quickly. We think, again, having been told that you need to lose all of this weight, that you're not going to feel good until you've got a good 40 or 50 or 60 off, right?
Right.
But to feel that good that quickly is something that's just so different.
I wasn't expecting it.
Yeah.
It was, I try to always say, the journey is to the individual. And, I just, I couldn't believe it.
So this first picture, I really love this. The first picture you've got here, down 21 pounds and 2 inches over my entire body in 4 weeks. Ideal Protein has 100% changed my life. We aren't stopping here, right? And
Right.
4 months, I guess, was also a quintessential visit that you had back with Dr. Nowacki, right?
Yes. Just kind of a checkup and yearly exam, just kind of see how things are going. I had told Dr. Nowacki I was going to do this. I was committed. And I went in and numbers were down. She walked in the door and she said, Jill, I can't believe it. And I mean, I wanted to cry. I thanked her endlessly because I couldn't believe the results I had gotten in 4 weeks.
Yeah, right. So 4 weeks, you're down 21 pounds. And then we don't have a picture, but you also told me about that there was a visit at 4 months.
Yes.
Yeah. So it was 4 months and 40 pounds.
Yes.
Right. And that was the one where she showed you some numbers had changed.
Yes. That to me, my A1C was down, which I found to be incredible. My BMI was down, which, hadn't happened to me ever in my adult life. It had only gone up. And seeing and hearing those numbers just made me a believer in myself. I was really on the path to ultimate health for myself.
You also mentioned too before, was blood pressure was an issue as well?
Yeah, blood pressure had been a little high, nothing too crazy, but it was down. And when she took my blood pressure, I always ask because you never really know, and she said it's great.
Yeah,
Music to my ears.
that's awesome.
Yeah,
So we continue on now. One of the things that we blew past was the idea that you started the program. You started Ideal Protein August of 2020.
yes,
And as we're remembering, August of 2020 was still kind of right in the thick of the pandemic,
right,
right? And one of the points that I wanted to bring out and congratulate your clinic for was the fact that they seemed so diligent and so great about continuing on the Ideal Protein protocol,
yes,
making sure that their clients had coaching and had food and all of that stuff.
right,
Because unfortunately, and in my area, and I'm sure in many areas, a lot of practices actually abandoned Ideal Protein during the pandemic and kind of left some people hanging.
right.
Um, so tell us a little bit about how did they manage that program during the pandemic? You told me that you were so impressed with the way that things went.
Yeah, they really left it up to the individual on their comfort level. Stephanie was always really great about, if you aren't feeling the best, or, you can't come in, or you're not feeling safe enough to do it, she always offered, video conferencing, telephone, with the ask of, when you can try to come in so we can monitor your weight, get those measurements, because that is part of it, seeing where you're lying,
Yeah.
as you're going along with the protocol. And the biggest thing for me was, there were times when I was sick and, didn't, wasn't able to make it into the office. I would call Stephanie, and, she would take my order for the week, and she would run it down and meet me in the parking lot.
Yep.
And they offered that to all of their customers, just doing drop offs, ordering ahead, paying ahead,
Yeah.
taking your phone calls, the whole office. I mean, there were definitely times where I would call and speak to a receptionist and say, hey, this is Jill. Can I put my Ideal Protein order in for Stephanie for this week? And, they handled it. And it's just,
Yep.
they were so well rounded,
That's
and so
great.
equipped to handle whatever the pandemic was going to throw their way. And I didn't struggle one time with getting my food or having the availability for someone to at least have it ready for me.
Yeah, no, that's just so awesome. And again, it does show the importance and the value that they do place on this program.
Right.
This isn't a little diet thing that they're doing on the side. They understand that this is something that is truly contributing to the health of their patients.
Yeah.
So I did want to give them a big shout out for that. So yeah, here we go again. Let's go from August to December of 2020. You're down 60 pounds.
Yes.
Right? That was that visit at 4 months. Now,
Yeah.
the other thing we talked about was your decision to do this right before the holidays. What were you,
Yes.
what were you thinking?
I was I was thinking we're home a lot. It was going to be easier for me, get-togethers weren't really a concern at that time. The temptation wasn't going to linger in front of my face in the form of
Right?
Christmas candies, all the good stuff. And just kind of the why not now, why not when I'm home and can prepare my home, prepare myself for
Yep.
this amazing change that I'm about to go through. The less temptations, the better the results.
Yeah.
At least in my
No.
case.
100%. And I so was trying to get people to adopt that spirit. You know what? We have no social gatherings where there's no peer pressure. There's none of that stuff. Now is the
Right.
perfect time to make a change. I realized I have been trying to get my patients to socially distance for years. Now that it's a term, I'm going to use that more frequently. But yeah, it's the perfect opportunity, and you
Yeah.
you seized that opportunity. And it was the perfect holiday season since there were not all of those get-togethers and temptations.
Right.
So we're going to cruise right along. We're down in that last picture. You're 80 pounds down,
Yeah.
get, getting so close to triple digits.
Yes.
How
Um,
much? How much of that felt?
it was just honestly, I feel like I say this phrase, life changing for me. I had never, it had been such a long time since I had been at some of these weights. And I just felt incredible. I think the biggest thing was just the amount of energy that I was feeling in my day to day, in my job, feeling like I was able to contribute more at work and at home, and just being more present, willing to say yes to more things,
Mm.
honestly.
Uh-huh. Yeah, well, and that goes right along with the idea. This is not a diet. We're not starving weight
Right,
off of your body. You have all the energy that you need and more energy than you've had in years, right?
right. Oh yeah,
Um, and because this is a metabolic reset,
right,
this is resetting your metabolism, and then in the process, we're losing weight, and
right.
that's what I like to refer to as meaningful weight loss, as opposed to starving pounds off your body. It's a totally different experience for sure.
It really is. And I like that you say meaningful weight loss, because every pound that I lost meant something to me. It was, I'm one step closer to my overall health goals. I'm one step closer to living longer. I'm one step closer to, being a better wife, being, eventually a better parent, and, being able to just provide more for myself and those around me. Those things meant the most to me, and my ultimate goals was just getting the most out of life.
Yeah, and seeing those numbers though, are you freaking out?
I honestly, I like, it was every time like I would go and weigh in with Stephanie, I would just look at her and I'm like, are you serious? Like,
Yeah.
are you serious? Me?
And so we're going to get to this point where you posted 100 pounds lost.
Yep.
What a day. What a day that is. Tell me what that's like.
It was at first I was kind of in a state of denial.
Yeah.
I was like, holy crap. Okay. I did this. I climbed this mountain that, so many people told me was going to be so hard and set such a long timeline for. And, I was just smashing the goals left and right. And it was just surreal.
Yeah. And I bet every one of the faces of everybody who told you you needed to lose 100 pounds was passing by in your mind, and you said,
Yeah.
"Ha, I did it."
Yes. There were definitely a lot of times internally where I was kind of like, suck it.
I love open, honest, and authentic guests.
Yes.
Yes. So, but tell me too, like at 100, you weren't really at goal, right?
No, no, I
No.
wasn't. No.
Okay. So we're pushing past 100.
Yeah, we were, I had told Stephanie, originally it was 100 pounds, and then I was, they were just kind of melting off. My goals kind of shifted. It was, okay, let's go over 100. And then at one point, it was 125.
Okay.
And then it was, let's get, my BMI to 30 exactly. And it was just an ever changing thing for me, because I was just continuously seeing these results. And I just felt like, okay, my body's still responding. We're still losing. Let's keep going. Let's
Yeah.
see where this takes us. Why not? It's so successful to this point. Why not?
Yeah. Why stop this train when it's just
Yeah,
it keeps
exactly.
on moving, right?
Right.
Except, I guess something went on, and one day something may or may not have made you second guess this.
Yes.
Tell us what happened, and I love the fact that this is a surprise for you, but take us through this as
Yeah.
it happened.
So I
Tell,
remember the date. It was the morning of April 28th. Regular day, was going to go to work. Just kind of had a spidey sense that something was different. I felt different for the first time in several months. My cycle was late, and I was like,
and so, and
okay.
I do want to go through this, right?
Yes.
before your cycles were crazy, like 6 months in between, 9 months in
Yes.
between, all that kind of stuff, right?
Right.
You started the program, you started the protocol, and you started tracking because the doctor told you that you might see them start to get closer and more normal like. So tell us
Yes.
about the tracking.
Yes. So when I decided, to kind of get more serious about this, Dr. Nowacki had suggested, finding a way to track your ovulation, learn your cycle, get a little bit more familiar with it. You're gonna, she had said you're gonna watch it, you're gonna watch yourself regulate. Your body's going to kind of connect with itself and kind of have that reset.
Yeah.
And I got into the diet, and for the first time, since I had been like 15 or 16, I was 28 days, 28 days, 28 days. And
Wow.
then on April 28th, it was day 31. And I was like, okay, maybe my body's just acting up. Something inside me said, we should probably take a pregnancy test.
Yeah.
And sure enough, 2 lines showed up, and I kind of did one of these, like, I was home alone. It was like 7:30 in the morning. I was supposed to go to work, and I wasn't expecting it. I just was like, just peace of mind, let's
Right,
just
right, right.
get on with it and go to work,
Yeah.
And I looked at it, and I kept looking at it, and I kept looking at it, and I was like, okay, we got to stop looking at it, and we need to call. We need to make the call.
Right. Make the call.
Make the call. So I called him. At this point, my husband had just gotten to work, and I was like, are you around anyone? He was like, yeah, why? And I was like, do you have a minute? And he was like, yeah, why? I normally don't call him this early because I'm
Yeah.
going to work.
Right.
Out it came. I'm pregnant. And he was like, oh my gosh, are you serious? And it was just like, I could just hear his excitement over the phone. We were both equally in disbelief. Here were these words that I'm like, we're not going to be hearing these words for a while. And there it was.
Oh my God. And so what did you do?
He came home, and he walked in the door, sat his keys down, and I was on the couch, and he just hugged me, and he just hugged me. And that was just what we needed. We just kind of had our little moment, and we just kind of sat in disbelief together. And I handed him the pregnancy test, and I was just like, here it is. Here we go.
Oh my God. Yeah. That's got to be just the coolest thing ever. Weren't looking for it. Again, still not really in your mind. We're not necessarily trying or any of that kind of stuff.
Right.
And just like that. Wow.
I mean, as far as I knew, there were still some doors that I thought, needed to potentially be opened, because I was still on my journey with Ideal Protein, and, was still on phase 1. And wasn't expecting that at all. And, I just thought that there were still some questions that might lie ahead for myself or potentially my husband. And the fact that we didn't have these questions anymore was just kind of mind blowing. Like, okay, wow. Okay. Right. Turns out I'm
fine. All right. And so, yes, here you are. And when is your next Ideal Protein appointment?
So Stephanie and we have been meeting over the phone just because it's been a little difficult for me to go in on a weekly basis. Fridays have been traditionally our day, Friday mornings, chat on the phone, Zoom, things like that. We chatted last Friday. She checks in with me, just trying to check up, make sure, I'm getting the protein in. She kind of gave me a suggested guideline for carbs, because we want to keep the gestational diabetes, at bay.
No, I'm talking about when you found out that you were pregnant, when was your next session going to be with Stephanie?
It was Wednesday. So it was 2 days after
2 days.
that.
2 days until your next session. And I
Yes.
think, and I don't know that our listeners or viewers understand, but we actually have Coach Stephanie in the studio with us. And we are going to bring her in to join this discussion because I want everybody to see what a coach and a client together look like. Let me get all this stuff going here. Let's bring her in. Hey, Coach Stephanie Parker, how are you?
I'm doing great. Oh my
So
gosh.
you've been reliving these days. You've been going through the story in the studio, listening to everything that Jill was recounting. And
Yes.
I'll give you a time that you can rebut anything that she said. However, about her behavior, her journaling, or anything like that. But I wanted to bring you in at this moment because I thought when I interviewed both of these ladies individually. I love to do this so that I can kind of get the story from both sides. And then I like to try to put things together for our viewers and our listeners to understand the special nature of a coach, an ideal protein coach, and their client. And, this is one of those stories that I think every coach would dream of. And so this is the quintessential moment, I feel like, in the ideal protein journey for both of you. So if I could set the stage, Jill just found out by surprise that she's pregnant. It's 2 days before her appointment. And Stephanie, you guys had kind of set up a system that she would pre-order and you'd have things available. Tell us a little bit about that.
Yes. So basically what we would do is I would have her send in what she wanted to order the day before our appointment. So then I have everything ready for her, and then we can just mainly focus on her and how she was doing, getting her measurements, and just focusing all our attention on her. So I noticed the day before our appointment, before she told me the most exciting news ever, she did not send me her order. And I was like, this is not like Jill. So kind of waited until she came in, and she had this kind of deer in headlight look. And I'm just like, okay, something's not right. And so it was like the minute we got in the room where we have our meetings and closed the door, she sat there and I was like, are you okay? And she was like, I'm pregnant. Like, oh my gosh. So we had our moment, and yes, tears were coming out.
Oh my God.
100%.
I'm close.
She's like, you don't know how many times I wanted to tell you, but I had to tell you in person. She's like, I could not wait for our appointment. I was like, I am so excited for you. Oh my gosh. Like, I was like, I knew something was up when you didn't send me your order, because it's like clockwork when, we say we're going to meet and we have everything ready. And so it was just, oh my gosh, it was one of the most exciting days of my life as well. I was like, oh my gosh.
And I feel like that is a dream moment for a coach and a client.
Yes, absolutely. Absolutely. I know she was just glowing and we were crying, and we were both in disbelief, honestly.
Yes. There were a lot of emotions.
Yes.
Yeah. Right. And then you're kind of like, oh, we got to change course.
Yeah.
Right.
Yes. Yeah. Yeah. And that day, that's when we were like, okay, so this is, we obviously can't do the program anymore. And then talked about what it was going to be like from this point forward, as far as, I still wanted to meet with her. If she couldn't meet in person,
absolutely.
I completely understood that. I was like, I still want to be able to meet with you, whether it's a phone call, video chat. I just want you to know I'm here with you every step of the way. This doesn't end here, I promise. And she's like, oh my gosh.
Oh, and that's so neat. And again, the value of having you right now to be able to guide her nutrition. It's not a hard stop. Oh my gosh, stop with the ideal protein program, do your own thing until you're done with your pregnancy. It's kind of like, okay, let's really make sure that we're monitoring and we're adjusting your nutrition based on symptoms and tests and all that great stuff, so that we can have the best shot at the healthiest pregnancy ever. That's so cool.
Right. Absolutely.
So great. Well, then, you know what? Let's spend a little bit of time with you, Stephanie.
Okay.
Tell us a little bit about your background. I think it's fascinating. We share a lot in common as far as our undergrad degree and things
Mhm.
like that. But you've gone in some interesting directions, and I think you're developing a really neat repertoire.
Yeah, yeah. I actually have my bachelor's. I graduated from IU and I have my bachelor's in health sciences. I am a fitness nutrition specialist and also personal trainer. So I knew, and actually, what's really crazy that I know we had talked about is I started with the program in August of 2020, and Jill was one of my very first clients.
Yeah.
And
Can you
so we've
imagine? Like,
been
one of your
together
first
every
clients
step.
is this
Yeah.
successful, right?
Oh my gosh. Yeah, I was like, this is awesome. So we really built that professional relationship, turned into an awesome friendship, still great friends today, and
Yep.
will continue to be. And so, yeah, it's just like, it's that connection for sure. And she's
Yeah.
a wonderful person. Absolutely. We connected right off the
Oh, yeah.
bat. Oh, you're so sweet.
Yeah, no, absolutely. Like I said, I've enjoyed every minute that I've been able to share with you ladies. Um,
Mhm.
and you and I had kind of talked about, Stephanie, that again, this natural fit of having the Ideal
Mhm.
Protein program in an OBGYN setting, that it,
Yes,
it just seems to make sense, right?
absolutely. Actually, one of our doctors, Dr. Vicky Sherman, had introduced the program to OBGYN of Indiana clinics back in
Yeah.
2016.
Okay.
Prior to me being hired on, I had no idea. I never heard of Ideal Protein.
Yeah.
And so just going through like my courses and certification and everything, just learning everything that I possibly could and talking to Dr. Sherman as well as the past coaches as well. And Brianna, who is the coach for Carmel and our South locations, and kind of picking their brains and just, I actually did the program myself. I did the alternative protocol because I
Hmm.
am a weight trainer. And also, the other thing that really connected Jill and I is I also struggle with polycystic ovarian syndrome. And so, knowing her frustration, and when I met her and just being like, we have a lot in common. Knowing what this program has done, I mean, at Axia Women's Health, OBGYN care centers, having this program in our care centers not only is a great match, but because our physicians see females every single day. We see women every single day with having polycystic ovarian syndrome,
Yep.
and which in turns causes insulin resistance. And so knowing that and then pairing all of the nutritional services with Ideal Protein with the expertise of our doctors, I mean,
Yep.
that's a perfect match.
It is. It's a
Definitely.
very
Yeah,
potent
yeah,
combination.
definitely.
And
Hmm.
evidently, Axia Women's Health was very excited about Jill's story,
Hmm.
and
Oh, yes.
they published this on their website, which I thought was really pretty
Yes.
neat.
Yes. Yep.
Yeah, so
Um,
awesome.
yes. They
So
reach out to
also,
me right away.
also too, did you mention? So, do you only see patients of your practice, or you also see anybody who wants to come in for weight management?
No, anybody. Yeah. Male, female. I have a lot of couples that come in and see me and they do it together.
Yeah,
And
that's
it's just
awesome.
wonderful because it's that support system that they have
Mhm.
not only with each other, but when they come in and we're all together, and accountability is huge. And so, yeah, we see men, women. You do not have to be a patient with any of our
Okay,
clinics either.
great.
If you're interested, then, just
That's
let
awesome.
Brianna and I know.
Yeah. So, again, as far as working with Jill, and Jill as far as working with Stephanie, I kind of put some questions out to you guys earlier. Jill, can you come up with, like, what was Stephanie's, a couple of her best tips or her best advice, both technically and or motivationally, when the rubber met the road?
Yeah, I think the biggest advice that Stephanie gave me was, she just always told me, keep going, find, just find the motivation to keep going. Remember why you're doing this, putting the why into the reason.
Yeah.
And with her background and her experience, she was able to just really help me. Every week when I came in, I had a question, regarding, the diet, or, there was a time when I came in and I was like, Stephanie, I'm craving potatoes so bad. What am I going to do?
I remember that.
Well, the mashed potato mix, of course.
Yes. And,
Yeah.
and she just always had, just an alternative answer for me that was going to, satisfy a craving, that was going to answer a question that I had regarding the protocol. Questions with, like taking, the vitamins and the supplements and things like that. She was just the guidance was there and the education was there to just kind of help me get through the initial, learning the knowledge, learning, why this works. And just really just kept pushing me to just remember why I'm doing this, and just having the overall knowledge that she did, just really was able to help kind of push me through this and, realize that I can persevere through this.
Yeah. And Stephanie, as far as Jill goes, what would you say were some of the qualities or some of the things that she did as a client that really made her successful?
Well, she definitely asked a lot of questions, which is great, because that's how you learn.
Yep.
That's how we learn. That's how we grow. But besides that, she always kept an open mind. If I was like, well, let's try this, or let's try like rutabaga fries or something.
Yeah, there you go.
She kind of get rid of that potato craving. She would try anything. And we just kept going, and she would literally come in every single visit and always have a smile on her face. And she was always so excited to learn the next thing, that we were going to do, or recipes provided. And she did not give up. That's the thing, is she did not give up. She followed the sheets, the whole eat the sheet. I'm sure you've heard of that. She followed it to a T. And that's what I had told her from day one. If we follow this from a T to a T, then we're going to get the 100% results that we want. And I mean, she right there, she's proof. She definitely is. So
yeah.
I'm getting misty-eyed over here, Stephanie.
I was too.
See, it's Stephanie making you cry, not me. It's not me.
I know. Okay, well, maybe I'm going to keep my promise.
Excellent. All right. Well, so yeah, again, I think both of you are probably looking forward to continuing on in this journey and seeing this pregnancy through. Jill, we kind of talked about, you hadn't reached goal when you got this wonderful surprise and this really great interruption. But probably designs on, after the dust settles and families settled in and what have you, maybe resuming that phase 1 journey and making some further changes.
That was one of the first things, I had told Stephanie when I went in for my visit, when I told her I was pregnant, I assured her, I was like, this story is not done. We are taking, we're taking a break right now. I'm focusing, keeping myself healthy for my pregnancy, doing what I need to do to, have the healthy amount of weight gain, not too much. And, I emphasized to her, I am dedicated to getting, hitting my overall goal. And just wanting, very, very eager to get back on phase 1, once, like you had said, the dust settles, every intention is there to just hop right back on. I loved being on phase 1.
Here's my other question that we didn't address. What was Dr. Nowacki's reaction when you told her?
She was so happy, because I had seen her, I want to say it was like 4 weeks before I had gotten pregnant. And I had kind of said to her, do you think it's possible for me to try, for us to start trying at the beginning of the year? And, she had jokingly said, she's like, Jill, she's like, we could deliver your baby by New Year's, and I'm due December 31st.
She's due December 30th. Wow, you took her literally. Holy
Yeah.
cow.
So when she saw me, she was like, "So, how about that, baby?" And I was just like, "How about it?"
Oh my God. That's amazing. So we might have a New Year's Eve baby or a
Yes.
Christmas baby. You just never know, right?
Whenever he or she decides that they want to make their grand appearance, I'm gonna be as ready as I can be.
Yeah. Yeah. Oh, fantastic. Excellent. Anything else you ladies have to add or anything that you had to say that we haven't covered yet?
I mean, Jill, it's just been such a joy being able to work with you. I mean, like I said, we've been together since like you had started my second week of actually me being able to see clients for Ideal Protein. And the connection that we have developed together, it's been wonderful. So thank you for trusting me.
Yes, I was actually
to
just going
trust
to
me.
say the same thing. I was, thank you for just, bearing with me while I was trying to, figure out, how this was going to work and, seeing it work and just, you believing in me from the beginning that I had this determination and I had this incredible ability to do it with the right tools. It just, it also helps that you're just a fantastic person.
Oh, okay. You're gonna make me cry now.
We're bound and determined that somebody's going to cry during the show.
I know.
That's the goal.
Hey, I actually thought of something that we didn't touch on that we had all three discussed. Part of the success of this program, or especially someone who's going to go this long into the program, is being creative as far as recipes go and making other foods and things like that. I know that all three of us share a love for the Geneva's Ideal Recipe Cookbook, right?
Mm-hmm. Yes, absolutely.
Oh.
Yeah. And so
Amazing.
Jill and I kind of talked about that, and that she really loved using that cookbook and found some really great recipes in there. And then Stephanie, you said that you guys do actually carry the cookbook in your clinic, as do we in our clinic.
Yes, we do. Yep. And then we have the new Essential Ideal Protein cookbooks as well. And then what I have done is I've created variety bags. So putting samples and then recipes per samples in a bag, and just to let people try it, so they don't have to buy the whole box, just to be able to try what they want to try. And they still have awesome recipes from our new cookbook as well. So
next level coaching right there, coaches. Next level coaching. Oh my God.
I loved the samples. That was something, especially when you're trying all these new things, you're a little skeptical. I would see a new product and I would say, hey, Steph, do you guys have this? Can I try it? See where and she always, yes, lady. Yeah, she was the yes woman for sure. Just always, and I was really able to expand, the amount that I had just because that was available. And, like when you guys did the Thanksgiving alternative menu, that was, that was a great thing, because temptation lies there, having that ability to make things that, hit close to home with Thanksgiving, kind of helps you get through that holiday hump for sure.
Absolutely.
Absolutely. All right. Well, thank you so much, ladies, for being with me today. Like I said, this is a very, very special show. I'm sure it's going to be one of our most viewed shows. So yes, we definitely will give one last shout out here to OBGYN of Indiana Fishers and Axia Women's Health. If anybody is out there in that area and is interested in weight loss, in having a new OBGYN that understands PCOS, please contact this place and get hooked up with Stephanie. She's going to help you get there.
Yes, right? She will, for sure.
I love it.
Thank you.
All right, ladies, I'm going to drop you guys out for a little bit, and we'll reconvene after I finish the show. All right.
Perfect. Thank you.
Thank you so much. All right. So I don't normally do this, but I thought it might be appropriate for this show and this topic, because I truly found this fascinating, and the rabbit hole that I went down, over the past few years, understanding the power of the ideal protein protocol, its ability to reverse insulin resistance, and truly what that means to potential patients, and the reach of this. So Ideal Protein had put together a slide in a presentation that they gave publicly, as well as intercompany, talking about metabolic syndrome and its tie to insulin resistance. And traditionally, when we think of metabolic syndrome, you may have heard the term, we're talking about abdominal obesity, high cholesterol, prediabetes and diabetes, and high blood pressure, those four. But also now there have been other things that have been lumped into metabolic syndrome, with PCOS very specifically being named. Non-alcoholic fatty liver disease, chronic inflammation, both musculoskeletal and GI tract, elevated uric acid, all of these things now are being assumed into the part of metabolic syndrome. And the link here is truly understanding that excessive carbohydrates, the chronic overconsumption of excessive carbohydrates, drives what we call hyperinsulinemia and insulin resistance. It's just a cycle, a self-perpetuating cycle, where the body stops listening to insulin and the body starts to produce more insulin to try to get the message across, which creates what we like to call carbohydrate intolerance. So at the center of metabolic syndrome, which includes all of these different things, is this insulin resistance, this hyperinsulinemia, or this carbohydrate intolerance. So very specifically, the Ideal Protein Protocol works on reducing the carbohydrates in our nutrition, restricting it tremendously for a while so that we can achieve the desired result. And in the process of doing that, we see the hyperinsulinemia calm down. We then, when the hyperinsulinemia calms down and goes away, the insulin resistance is allowed to heal, as well as so many of those health markers that are involved in metabolic syndrome. So this is quite possibly the mechanism, the metabolic reset portion of the Ideal Protein Protocol, that has an opportunity to create meaningful weight loss, metabolic reset, and get your health markers back in the normal ranges. So just wanted to add that in there. A little too much science, but I'm geeking out and I'm freaking out over this episode. Those two ladies were absolutely amazing. I hope that if you know anybody who is suffering from polycystic ovarian syndrome, your friends or your family, you will pass this show along. As always, I like to say, please like, subscribe, share us. In fact, I found out we've got like 985 followers. Come on, help me out here. Can somebody get me to 1K? Let's get 15 more followers from the show. Get me up to at least 1K, and let's move the show forward. Thank you again. As always, keep pursuing your life possible.